Hello, and thanks for joining us on Medwatch today. I'm Vanessa Villafuerte. A groundbreaking procedure offered right here in the Central Valley is giving hope to patients facing possible amputation. The technique dates back decades, but has been perfected by a team of local doctors. They're the first in the nation to use it, and it's already changing lives. For those with advanced diabetes and vascular disease, the prognosis can be grim, often resulting in amputation. But doctors at Valley Foot and Ankle are changing that. They've introduced a procedure to the Central Valley that's giving patients a second chance at keeping their limbs. Tim Shortnessy says if it wasn't for the procedure, he might not be able to walk today.
Definitely amputation was on the table. And I guess the question then was, how much do we amputate? I had a foot sore from stepping on a tiny sliver of glass. That was a tiny puncture wound in my foot. But because of a lack of blood flow to my foot, the wound kept getting bigger and bigger.
But thanks to doctors Emmy Oji and Gan Golshteyn, Tim now has the life he thought he might never have again. One where he can walk, travel, and live his life freely.
I'm having to retire from my job because of this. It's been difficult. I'm sorry. But I have hope that I can have a good life.
The procedure is rooted in decades-old science. It was first developed in Germany in the 1960s. Doctors Oji and Golshteyn, podiatrist surgeons at Valley Foot and Ankle, have worked tirelessly to adapt it here.
So this procedure will help expedite or maximize the perfusion to their extremities and essentially help with pain, which is essentially a lot of the studies found like their pain scale, their VAS pain scale significantly improved within 2 days of the procedure.
The device, called a Fixator, tricks the body into healing itself by mimicking a fracture.
This procedure is innovative, right? So what it does is it allows patients the opportunity to perhaps save their lower extremity. So this procedure allows us to basically cut the bone in the lower leg, put a small device on that these patients do not feel, and trick the body into thinking it has a continuous fracture. And that allows them to basically increase their blood supply to the leg, therefore stimulating healing, because without bleeding, there is no healing.
The stakes are high. Dr. Oji says a below-the-knee amputation can shorten a person's lifespan dramatically, raising the 3-year mortality rate to nearly 50%.
If they lose a limb, it's up to 49% 3-year mortality rate, unfortunately, and it goes up to 70% if you go up to above knee amputation. So it affects your mortality and morbidity, right? So, and also your quality of life.
And Tim, who has battled diabetes for years, says the stigma surrounding the disease makes the experience even harder. But still, he wants others to know there's hope.
I'm diabetic, and that was probably the primary reason for being in the situation that I was in. I would just like to point out that diabetes is a disease, and a lot of people assume that if you're in my position, it's because you don't follow a strict diet, or you're eating chocolate cake every day and your blood sugars are out of control. I am not.
For more information on diabetes and treatment options right for you, Dr. Oji encourages patients to talk to their primary care provider.